This conference will now be recorded.
Hello everyone, this is Sally Buck, CEO at the National Rural Health Resource Center and the technical assistance provider supported by the Federal Office of Rural Health Policy to provide resources and information and tracking on the Small Rural Hospital Improvement Grant Program, or SHIP, for state grantees. We're happy to provide this quarterly webinar to our SHIP TA team for the state grantees, and the topic today is looking at contract development, and this topic is based on feedback that we received from all of you with our recent state technical assistance assessment that we conducted in May, and is a way to look at avoiding unobligated balances given the structure of the SHIP programs with subawards to the small rural hospitals in your states, that there's different perspectives of contract development for consortium activities, networks, and overall contracts. So we've invited Rebecca Jolly from the Rural Health Association of Tennessee and Catherine Miller from Wisconsin State Office of Rural Health to share some information and best practices. But first up, I'm going to turn the time and slide to Bridget Ware, the Program Coordinator for SHIP from the Federal Office of Rural Health Policy. And Bridget will provide a federal update, as well as we'll have some time here to walk through the proposed fiscal year 19 SHIP changes. So *2 to unmute, Bridget.
Hi, thank you, Sally, and good afternoon, everyone. By now, everyone should have received your notice of award. If you haven't, I would encourage you to contact your grants management specialist. Also, I wanted to let you know that in the coming weeks, you'll be getting a call from your project officer, whether it's me or Janine Myers. And there's nothing wrong. This is just a protocol we undertake each year to answer any questions that you might have about your own award. So look for that in the coming weeks. About 2 weeks ago, you all should have received notice of some of the proposed changes for the FY19 SHIP. And at that time, we asked for your feedback. And I've had a few folks email to clarify some points. And I just wanted to take to go over what was sent out and have a further discussion if folks had questions or concerns, or just to get your feedback on this. And I warn you, if you have feedback, give me some solutions for your issues. So that would be much appreciated. So to begin with, we are...
This conference is no longer being recorded.
We're moving from a...
This conference will now be recorded.
We're moving from a 3-year time period for project period to a 5-year project period. So that's probably change number 1. We are asking that you submit your budget request at $10,000. So we're moving up from the $9,000 that we've had in prior years to $10,000 per eligible participating hospital in your budget. So please plan your budgets accordingly. So the projected date for the notice of funding will be September 21st, I believe. That's the tentative date right now, and it would be due December 20th. The format for the FY19 competing continuation, which this will be, the format only will be pretty streamlined. We'll have a section with the intro, needs assessment, overview, and then simply goals 1 through 4 with Goal 1 being applicable to everyone. Tell us how you're going to administer this program, how you verified your hospitals, how you're going to execute contracts, what are your timelines for completion of these efforts, and what's your process like. So this is strictly for pertaining to the SOAR. Goals 2 through 4 will be concerning the typical ACO, value-based purchasing, payment bundling, prospective payment system. Those will be your activity detail sections. If you don't have anything in those, any hospitals participating in those, just simply put no information or no hospitals participating. This isn't something that you have to struggle to figure out or fill in at this time. So Goal 5, which we've had some questions on, is really meant to be a snapshot of your outcomes based on your year. So rather than have you submit information in your application when you've barely gotten started getting through your year of administering the program, we will now wait until after the budget period is over, and then you have 90 days to complete your report and submit it to HRSA, and we'll review your report for the prior year. So I hope that makes sense to everyone. One of the things that I had also sent out, yeah, I'm sorry. Let me just stop real quick before I go on. Nancy Joe asked the question about 10,000. We round, so we never know quite what we'll have in terms of a budget for the SHIP program. So we ask that you round. Sometimes we'll have more. Sometimes we may have less available. So we just ask for a round number. In years past, it's always been 9,000. And sometimes we've given 8,700. Sometimes we've given over 9,000, 9,100, 9,400. So we round, and so 10,000 is a nice round number to us, and that's what we're asking for in the budget. So going back to one of the changes for the proposed changes for FY19, we had thought to do something around encouraging hospitals, networks, and consortia, but now we're not going to have a hospital cohort. We're just going to include what we're terming a special innovation project, and it is open to SHIP-specific network and consortia. We're looking at projects running a minimum of 2 years, which after they've run 2 years, they can be changed and they've been completed. They can be changed, but we're looking for projects that will run for the entirety of the 5-year project period, that have a unique innovation with regard to SHIP, and that is within the guidelines and within SHIP legislative guidelines, but also demonstrates a level of innovation in either process or selection or evaluation and meeting the needs of the hospitals or provider-based rural health clinics, which are also included in this. We are working on and have an example of what a special innovation project, so we're calling it a SIP project would look like, and we'll have that available for everyone as well. So that's sort of the new, and there'll be there'll be less reporting, there'll be streamlined reporting for the special innovation project, but at the end of the time period, the project period, we will look for outcomes and measures beyond simple output. We will look for we will expect longer-term measures to be projected at the beginning, and then a level of measure that shows how well it went as expected, or what deviations and what were your lessons learned during the time period. So while it's less reporting during the project period, at the end we will expect information and additional data on how it went. Again, I mentioned the reporting, the progress reports being due 90 days after the submission of your non-competing continuation report, and we will design a format for that as well and have that available to you. And so for the most part, we heard, we listened, we tried to make some adjustments to the SHIP program based on comments that we've gathered through the years, talking with the folks at the Rural Center, talking with you individually, and then just internally recognizing what flexibilities we have available with the program and what we can and can't do. So we try to be responsive. We try to make sure that we're on trend with what the needs are, and refine the menu, the SHIP investment menu accordingly. And that includes, providing additional examples and templates on the website, on the Rural Center website, and having more robust technical assistance calls like we're on today. So if you all have any questions or comments or concerns or confusion, please feel free to ask it now, or email or call later after the call if you don't feel comfortable doing that. And I'm happy to discuss it and respond to any questions that you have now.
Remember, if you have a question for Bridget, please press *2, or you can type your question into the chat box.
Hi, Rebecca. Thank you. I'm glad you love it. The September is when the guidance should be coming out, and December is going to be when it is due. So tentatively September 20th, 21st, and due December 20th. Same question, Tammy, I see.
Any other questions or clarifications on the fiscal year 19 SHIP program changes for Bridget? And again, okay, a couple more typing, and as she also noted that Bridget, the start date for fiscal year 19?
The start date doesn't. Yeah, the start date won't change. It'll still start. It'll still be a June 1st start. No, it's not a 2-year grant. These are 1-year budget periods, but we're making it a 5-year. It's a 5-year project period. No, it's not mandatory. It is an option for hospitals to be in a cohort.
Any other questions?
Hi, Carol. Yes, the grant period, the grant year is the same. It'll start on June 1, 6/1, and it'll be for the year and end on May 31st. You're welcome.
So, Bridget, maybe we could clarify too that although it's a 5-year project period, being that it's competitive with the full grant application with the needs assessment, so forth, or I'm sorry, the overview, the needs assessment, and then as you outlined the 5 goals, that would be done in the fall for the project period beginning June 1, and then in the subsequent budget years there would be a non-competing continuation completed for the number of hospitals and the amount of funding the state is seeking for based on number of hospitals at 10,000 each, but the reporting will be not submitted into electronic handbooks till 90 days after May 31st each year.
Yes, thank you, Sally. That's correct.
Okay, great. Thanks, Bridget.
You're welcome. Thank you all.
Yep. Okay, then we'll move into some information around contract management. And our first speaker is Rebecca Jolly, and she is Executive Director at the Tennessee Rural Health Association of Tennessee, RHAT, as they are known. It's one of the largest rural health associations in the country. And prior to leading RHAT, Rebecca worked with Affiliate Enterprise Solutions in healthcare consulting, and also brings previous work, 15 years of healthcare and hospital association management experience in policy and member engagement, and also business development with the Louisiana Hospital Association. So I'll turn it over to Rebecca, and then we'll move into Catherine Miller's presentation. And Rebecca, star 2 to unmute.
Thank you so very much for that introduction, and thanks for having me with you today. I'm going to do a mic check to make sure everyone can hear me. So are you hearing me, Sally?
Yep, we can hear you.
Perfect. Thank you. Well, in our time together today, what I'm wanting to do is walk us through the project life cycle as it relates to the SHIP program. It is the expectation that this information will be used to help develop and define clear contract expectations within your statement of work. In addition, we want to outline expected timeline for deliverables and planning for consequences in the event that some of those deliverables may not be met. And then finally, establish reporting requirements that demonstrate the impact of services provided through this very valuable program, the SHIP program. With that being said, I think that we're all familiar with the 3 areas of focus that impact the SHIP program. And those areas are, of course, the value-based purchasing programs, accountable care organizations, and bundling payments. So I think most of the SHIP grants are typically housed within your state office of rural health. I've heard of a few states that may have outsourced the actual program implementation, but I think that what I'm going by today is that the majority are actually still housed within the state office of rural health. So with that in mind, we all are aware that the SHIP program really helps us enable states that are targeting small hospitals in improvements in several different ways. And a few of these examples are, of course, the purchase of equipment and or training to attain value-based purchasing, joining or becoming an accountable care organization, or creating shared savings programs, and then also the purchasing of health information technology, equipment, training to comply with meaningful use, ICD-10 standards, and payment bundling. So with that overview of the SHIP grant in mind, I wanted to walk us through the 4 phases of our project lifecycle. So if you break down project management methodology, it helps to define the project scope, your timeline, your resource allocations, and deliverables of really any given project. So to deliver successful projects from start to finish, we're going to walk through our entire project lifecycle step by step, and I'm hoping that this will assist our SHIP programs with using similar project management processes for delivering on the objectives of your various state-based SHIP programs. So the goal of using these methodologies is, of course, to complete the tasks required for the project more effectively, and hopefully with some strategies in place to handle issues that they may arise. So that being said, we'll kick off with our initiation phase. This is the first phase of any project life cycle, and is when the project manager really just starts to conceptualize the overall project. So in this phase outlines really the basic processes that must be performed to start the project, and should begin to specify what the project output is to accomplish. So within this phase, it's going to take place pre-grant award, and this is going to be the time for the project team to begin to outline the scope of services necessary to execute the objectives outlined in your grant proposal. So prior to grant award, it's recommended that SHIP program coordinator and or the State Office of Rural Health Director really work together to identify the portions of the grant where the state SHIP program does not deem that you might have the access to the appropriate level of expertise within your organization, and identify the program activities that you might need to look at subcontracting for. Additionally, looking at your hospitals that you're going to be engaging and where they may need to start looking at subcontracts, and just starting to have those conversations and conceptualizing what you're going to try to accomplish. So after the reward of your program activities, your team can then really start to assemble various categories of work that require common skill sets to complete. So this is going to be the beginning of the process to define the deliverables for any given subcontract, and it's also going to be work performed under the grant funding reaches across all of our healthcare sectors. It's really going to be necessary to develop detailed subcontractor selection criteria in order to facilitate the method of selecting the most appropriate subject matter experts for any of our given tasks. So with that in mind, we'll look at our subcontractor selection criteria. What are we looking for as we're contracting for services in order to implement our SHIP grant? So once our deliverables have been outlined, our next step is, of course, to determine the skills needed to complete those contract program activities. And this is going to be a great opportunity to send out maybe a request for proposal to various state partners and identify field experts with a known and demonstrated knowledge base in the areas of required expertise. So a lot of us have great relationships with local partners, but if those aren't available, we also have project teams. Your project team could also send out maybe a national search for nationally recognized subject matter experts. One of those that easily comes to mind for me is definitely the National Rural Health Resource Center. So they're convening us today, and they're definitely a great base for reaching out and developing some of those skills and resources that you might need in order to fulfill some of your SHIP grant objectives. So networking and relationship building are definitely key components to identifying individuals or entities to partner with that bring really known talent to your project. But overall, we're breaking it down into good written and oral communication skills and established and trusted relationships with rural hospitals. That's definitely a priority here. Obtaining references from trusted sources, clearly understanding your project deliverables and articulating that through maybe the utilization of an RFP, and just the availability to perform the workload within your grant time constraints. And that's a big one. I know we all have a lot of horror stories of grant time constraints where we may not have been able to achieve everything that we had hoped for, and keeping that in mind as we're looking for our project partners in implementation is definitely a key and priority. So once we have really identified our initiating phase, and we're going to now move into the second phase of your project, which is your planning phase. And this is going to be your second phase of the project life cycle. And the purpose of the project planning is really to start to identify your scope of work, your deliverables, and your payment process for services rendered. It's also a great time to address communication and the deliverable of completion acceptance process. This is a planning process that will help guide the project team through the execution and closure phase of your project. And the time and effort definitely spent during this phase will assist in managing your time, your costs, your quality, your risks, and your issues as you're going forward. Your scope of work, developing your scope of work is really important that we utilize clearly defined deliverables that are tied to a definitive timeline and delivery dates that are going to be executed to ensure basically your overall successful relationship with whoever your contractor is or your grant partners for completing your grant activities. Your scope of work should establish expectations for deliverables, including defining the outputs, which are your contract deliverables, versus the outcomes of the project, which are your interventions provided by your contractor or your partners. It needs to establish benchmarks to be utilized as baseline measures, and it also needs to have methods for tracking key performance indicators for determining your outcomes and the impact of your services. So within your state, how does your state SHIP team complete the planning phase of work? Are you looking at an RFP process? Are you collaborating with different state partners? Are you utilizing your state office of rural health for team input? I think these are all just good questions to ask yourself as you're going through that planning phase to make sure that we're bringing in all of the expertise that we can in order to have a successful implementation of your grant. So moving through your planning phase, we've mentioned deliverables a little bit. One of the things I wanted to do is define your deliverables. So if you're looking to subcontract or contract any of your work, it should include contractual clauses for building accountability and holding your subcontractors accountable for ensuring that all of the contracted deliverables are met. The time frame for the agreement should include the contract execution date, your milestone date, and deliverable completion date. Developing milestones can be achieved by breaking larger, longer projects down into events or processes that show really timely progress of the work to be completed. And then we also want to look at failure to build in this accountability. What does that do to our overall project? So failure to do that could result in ambiguous deliverables that just don't address the intent of the original agreed upon work output or what you had put in your SHIP grant award. So it's really imperative that it's very clearly understood what your SHIP coordinator is contracting for and what services are being expected to be provided and what you're actually going to measure against. So the next is your project payments, and definitely tying those payments to specific deliverables is going to be a key for success here. So if you want to look at structuring your payments in a fashion where really the SHIP coordinator or whoever is responsible for the oversight of those deliverables maintains a greater ability to hold your contractors and your grant recipients accountable to the delivery of quality and timely work. We will need to have clearly defined deliverables that are, if they're not met in accordance with the timelines defined in the contract, such as delaying, modifying, or withholding of payments, these are all going to be options that you need to be able to utilize to incentivize an underperforming subcontractor, or if you look like you're just not going to be able to achieve some of the goals, you need to be able to have that control within your project payment that you could maybe exercise some of those options. Also looking at if you do have deliverables that are not being timely met, you could include such things as maybe partial payments for missed delayed deliverable dates, non-payment for work not performed per contract specification, termination of the agreement for failing to comply with the terms of the contract, and the terms should all be clearly outlined in whatever your executed agreement looks like. So those are all just things to consider during your planning phase as you're really starting to firm up your deliverables and what your payment for those deliverables is going to look like. So still in our planning phase, I did want to talk about data sharing, because a lot of the projects that you're looking at are going to be investing in utilization of mechanisms to share data in order to improve outcomes. So a key objective, of course, of the SHIP program is to assist all of our eligible hospitals in meeting the cost of implementing data system requirements that are established under the Medicare program. As we discussed earlier, these are including such things as value-based purchasing programs, your accountable care organizations, and payment bundling. So with that in mind, your SHIP program coordinator should really consider including statements within your subcontractor or maybe your contractor's scope of work that would utilize available data programs as it's appropriate to support your assessments in your project. Several resources of data really reside within operations of various state potential partners or potential state partners. These are including, but certainly not limited to, your state hospital association, your state rural health association, your quality improvement organization, and state health information exchanges. But really, to move forward with the sharing of data with any of your contractors or subcontractors, you need to definitely have in place data use agreements and or non-disclosure agreements. And I know that the National Rural Health Resource Center has examples of those on their website. If you need to pull those together in order to have some examples of what a data use agreement or a non-disclosure agreement might look like, they're a great resource for that. And those agreements should be included in your subcontract to address basically how your data is going to be accessed and kept in a confidential way, and then also how you're going to support data sharing. So upon executing a data use agreement in your non-disclosure agreements, it's really an important step in the subcontracting process to ensure that all of the sensitive hospital information will be kept confidential. So in the event of a breach of data, the data use agreement and your non-disclosure agreement is really going to be the tool that provides your program with a means to pursue corrective action or remediation for damages in the case, heaven forbid, that there is negligence on the part of one of your partners. So a verbal agreement is just really not adequate with those, especially it's not an adequate substitute for a formally executed data use and a non-disclosure agreement. So just keeping that in mind as we're dealing with data that relates to this program. So our third phase of our project life cycle is where we start really putting the rubber to the road, and that's your execution phase. This is typically going to be the longest phase, and it involves implementing the plans that were created during your project planning phase. So this coordinator is now going to be responsible for ensuring that the activities of the grant are kept on time, on or under budget, and within the defined scope of work. So this work is really broken out into two different areas. One is your technical monitoring, and the other is going to be your financial monitoring. So first, as it relates to technical monitoring, your contractors or your grant partners should really report your progress on all established key performance indicators and timely completion of contract deliverables back to the SHIP program coordinator at regular intervals throughout the life of your agreement and your grant. So maybe conducting quarterly status meetings with some of your partners or monthly calls would be a useful and highly effective method to track just the timely progress of work towards completion of the deliverables. Communication is best if it's in writing and inclusive of an update on the progress of the work that was included in your scope of work. So I know that the center has previously produced some helpful toolkits that provide tips, especially for our flight group, and I think that they're equally applicable to this group for SHIP. And those are hyperlinked in this slide for engaging subcontractors and partnering and demonstrating outcomes toolkit. So you may be familiar with that from the FLEX program, but I think it has equal application for SHIP as well. Another one that is a FLEX program that's applicable to SHIP would be for financial monitoring, your FLEX program subcontractor tracking spreadsheet. So this is a valuable toolkit that really includes tools, tips, and communication strategies with an emphasis on financial management and the overall revenue cycle of your contract. So this is helpful information, so it really assists in guiding the monitoring of your financial performance of your grant. Next up is looking at your closure phase of your project. So this is going to be your final phase of your project life cycle. And it's going to include the submission of closeout notices, the submission of final deliverables, and your final invoices. So during this phase, it's going to be pretty much predetermined by the end of the contract timeline or by the end of your grant fiscal year. So that's going to define where this happens in your project life cycle according to those dates. And then as a SHIP coordinator, you're responsible for ensuring that all of the contracted work is going to be completed within the time frame and to alert anyone as to the final dates for invoices that will be accepted for processing and payment within the SHIP grant so that people know what their dates are and what their obligation is to you in order to timely and effectively close out their projects. So this is also the point that some of us get to in our project where we realize we have contract deliverables or grant deliverables that may have not been met for some of the following reasons. Deliverable timeline wasn't met, your scope of work was not completed, your data reports may have not been delivered, or maybe you have failure to provide benchmarking tools or demonstrate outcomes of your project. So what, as far as the SHIP program coordinator or the State Office of Rural Health, what do you have as far as a tool that could look to mitigate some of these risks? And a large one is definitely around payment for services. So if a contractor does not deliver on some of the items in your scope of work, it's really important that this is where we have those payments tied to milestone completion and clearly defined deliverables, because that's what gives you really a leg to stand on as it relates to pushing at the end of your project life cycle to close out and deliver on time and have payment really only upon the completion of deliverables. So that is a very important piece in your closure phase, is that you don't want to pay for work that has not been performed to your satisfaction. So, in just overall conclusion, the SHIP program is a very valuable program, and I have participated in it for years now in my career. I just appreciate it as it provides resources for our SHIP-eligible hospitals to really improve the quality of care that they're providing to their rural patients. But it's also imperative for funding of the SHIP program that we can demonstrate the impact of that federal investment in our rural communities. A big part of that is really just telling the stories of how the program has and continues to make a positive impact in the delivery of safety net healthcare services throughout rural America. I think it's imperative that the rural communities demonstrate the impact of federal investments of resources through activities such as this program, the SHIP program, and really through tracking and demonstrating those successes through benchmarks and utilization of available data. The overall SHIP program is strengthened. So at this time, I will certainly open it up for questions or turn it over to the moderator for the next speaker.
Thank you, Rebecca. If there's questions, folks could put that in the chat box, and then we can address those as we wrap up. And now we'll open our second presentation. We're kind of building upon the contract management and looking at state spotlight with Wisconsin and how they have developed and utilized an access database for tracking grants. And from the Wisconsin Office of Rural Health, we have John Ike, their director. And John has been with the office since 2005 and was appointed director in 2006, and works in, of course, the overall state office director role, but also works in community development, program planning, systems analysis, and design. And Catherine Miller, who's a Rural Hospital and Clinics Program Manager, has been with the Wisconsin State Office of Rural Health since 2008. And prior to that, she worked in human services in Greene County. And so I'll turn it over to Catherine and John. You get just a reminder, star 2 to unmute.
Okay, I'll make sure you can hear me.
Yeah, sounds good, Catherine.
Okay, I'm not echoing, am I?
No.
Okay,
That's good.
Great. Okay, so I have control of the slides then? Yes, I do. Great. Okay. Well, thanks for inviting John and myself to speak today on our database that we use for tracking our grants in our office. A little history on this. We've had the, right now it's just called the Access Database because it's in Access, so we haven't thought of a better name for it yet. Really this started a few years back when I was maybe 4 or 5 years into my role as Flex Coordinator, and really having a difficult time trying to manage all the aspects of the Flex grant. And then I had recently took over SHIP as well. So we have so many kind of sub-activities within the Flex program, and then also keeping track of important milestones or to-do lists for the SHIP grant. So we started brainstorming ways that we could better organize all that we had to keep track of. And so this was really John's brainstorm to come up with an access database that we had built for us with our Department of Information Technology in the UW. And so this has really, really been a huge gift and a huge help to help me and the others in our office stay organized. So with that said, this was really designed at the heart of organizing Flex, but it's come in handy for SHIP. So I'm going to talk about how we use it for both of the grants, but it is heavily, or I will be heavily talking about Flex and how we organize the Flex grant. So some of the key features of the database, it serves many functions, not just to remind us of when we have things to do and due dates. It's a comprehensive contact database, so it has a listing of all of our critical access hospitals, of which we have 58 SHIP hospitals, so all of those plus an additional 6 small rural hospitals and about 80 rural health clinics. We have not yet used it to track all of the EMS agencies. We have a few hundred of those, so we haven't quite taken that step yet. So we keep a running organizational look at each key position in the hospital or in the clinic. So we know who the CEO is, the CFO, the DON, the quality, any key staff that we want to keep track of. And as we know in our hospitals, we do see a bit of turnover. So we're able to enter a new person in the system and not lose track of, for example, what projects that hospital is participating in, or who the main, if somebody leaves their position and they were our main grant contact, we don't lose that capability. So we'll enter a new person and they'll be linked to all the roles that that other person in the hospital had taken charge of. So as I mentioned, it's also a to-do list, important milestones that we have, important due dates we have to remember because it's so easy for them to slip through our fingers. Things that we might do, let's say, every September, so we just have to remember it once a year. We're reminded of these important reoccurring due dates, and then any due dates that come up. Another feature is that it tracks the budget of each of our activities within the FLEX program. So we might have a project and we know it's $50,000. We know that 5 hospitals are participating in this project, each at $10,000, for example. We know when invoices are paid, their remaining balance, and also reminders. It'll let us know when we need to remind a hospital to invoice us. And finally, we have the ability for some nice printable reports. 2 examples are that to-do list, or called a milestone report, and then also print out of any outstanding invoices that we have. So let's start with going over how we use it for SHIP, because again, it's much more complex to explain the FLEX program and how we organize that. So again, it maintains a list of all SHIP contacts. So who's the director of the project, who's in charge of the SHIP project, and then anyone else who wants to receive SHIP-related information, like when the applications come out or when they'll be receiving a contract for their SHIP funds. Also in historical records, so we can go back to, I think, 2012 area and look at different SHIP years as well, not just this year's current SHIP year. As I mentioned, it tracks milestones or any important reminders that we need to know about SHIP. And then I think the real nice feature here is tracking the budget for each of our hospitals. So we have about half of our hospitals who are receiving the approximately $9,000 grant. The other half are in a network project. So we're able to keep track of who's in the network project and who's getting an individual grant. And then have they invoiced us yet? How much is left? And again, milestones. Who do we have to remind to send us an invoice? That's all right there at our fingertips. Okay, so I made a series of screen prints so you could just get a general picture of what we're looking at each day. And I just redacted some of the information, like people's names and contact information. So what we have is the project name. Up here you see it's called SHIP. So technically SHIP is a project, as is classified in this database. So if I want to know anything about SHIP, I have the grant year up there in the right-hand corner, 1718, so I know I'm looking at the correct year for SHIP. We have a start and end date. We have, oh, thank you. We have who the primary contacts are, so we know that there's 2 of us kind of overseeing this in the office. We know who's primary and who's helping out. The total budget, and then what our current balance is, so we know how far we've spent down in SHIP. We know what we have remaining. So in the bottom left is where we have all the contacts for each hospital. So we know who our primary contact is. We know who the person is we have to contact. a nice feature there written in that little blue bubble is that those two icons allow us to instantly send an email to everybody. Just by clicking on that, the window pops up. We can say, hey, the SHIP grant is starting June 1st. We'll be sending your paperwork, whatever I want to say to the group. And we had that set up actually so it's blind copied, so we're not releasing anybody's contact information to other hospitals. I can also export it to Excel, which is really nice. If I need to do some kind of sort and I only want to send it to certain hospitals, I can easily do a sort list and see who my contacts are. And then in the lower right will tell us the budget. So here if I'm looking at Mayo Oak Ridge, what I've done is just click on the left-hand side onto Mayo Oak Ridge. Their information comes up, and it shows me what they got for a grant, what they've billed us, what's left, what's their PO number with the university. So each hospital gets contract paperwork from the UW, and this will tell us that the number of that contract paperwork. We can mark when an invoice has been paid as well. The next slide is also on SHIP, and this just gives you an example of when I mentioned the Milestone Report. So this gives us reminders when we need to send out invoice reminders, when the invoices need to be due to us, when we need to notify hospitals. So there is a lot of data entry on the front end. We have to enter all the hospitals, but the nice thing is that there's a function where we can take the hospitals from the 16-17 year and just kind of import them into 17-18. So we don't have to data entry that every year unless the contacts have changed, but we do have to re-enter some milestones. So it's very important to have this set up as much as we can on the front end and have whatever we anticipate those milestones will be. And then we can always go in there, as I do about on a weekly basis, check the milestones and add to them if I see something maybe I forgot. So what we do each week is we meet as a Flex and SHIP team. There's 4 of us who meet, and our project assistant will print a milestone report and just go over, hey, here's what's due in the next coming weeks. So it's only going to be as useful as the time you put into it as far as data entry on the front end. For example, in the next month or 2, we'll be putting in milestones for the Flex grant since we know that award and the year will be starting very shortly. And then you have to look at it. I have the database open every day, and then at least weekly we have a sit down and really look at those milestones and due dates. So on to talking about uses for Flex, which hopefully applies to a lot of you on the phone call here and will be helpful. Again, it's a database, and all the key staff members are listed in there with their contact information. It tracks all of our many Flex projects. So we'll have HCAPS projects listed, we'll have financial projects listed, and again, SHIP is a project. As I'll point out too in an upcoming slide, we have MBQuip listed as a project. And that's just so that we know every contact out there that needs to get MBQuip reports or needs to know of any upcoming important information on MBQuip. So, you know, technically it's not a Flex project as we think of, hey, I'm going to do this particular HCAPS improvement project, but we list it as a project so we have good contacts and good history. And again, historical records, so we're able to view what we've done in past Flex years so we don't lose track of that. Milestone report is very useful here so we know what to-dos we have for the week or the month. And a nice feature is it keeps track of the outcomes, outputs, and PIMs all in one place. We can all go crazy trying to keep track of all of those, and there's different due dates for all of those, and it's nice to be able to look at a project and say, oh yeah, here's my outcome, and oh, I have to ask my vendor about that. I have to get this hospital to give me this outcome. I have to measure this output, and so I have all that ready when, say, the PIMS report is due. And again, it tracks the budget for each activity. So again, some information redacted here. How we have this set up is at the top we have those 5 tabs. And so right now we're looking at the Facilities Entity tab. So this is a medical center. We'll have their name, their location. We mark if they're a critical access hospital. Obviously, if they're a hospital, we choose that in the drop-down. We also have clinics. We also have contractors. So that's why it's also called entity. So we can list, say, the Wisconsin Hospital Association, and we know who all of our important contacts are there. So we assign each person a role type. So that middle column in the lower half, we have a role type called CFO. So even if their title isn't CFO, maybe it's financial manager or something like that, we know that their role in the hospital is CFO, so that they're the ones who we would get financial information to, or if we needed to know who that individual is at a certain facility, we would know that by looking at their role type instead of their title. So those are contacts, and then the next is still in facilities, but it's the projects. So what projects is this hospital involved in? Of course, SHIP, MBQIP, so they'll get MBQIP reports. They're participating in MBQIP. And then a couple examples here. They're in our event reporting project. They're in our rural stroke improvement project. So we will know easily by looking at an activity name which hospitals are involved and who are our contacts. So this this is the contacts page where, again, it'll just give us some more detail on, in this case, the quality coordinator. Who is it? What's their contact information? And again, which projects are they linked to? Okay, so there's a lot to talk about here when we talk about projects. In the upper right hand, so we pick a project year. So in this case, we're looking at what we did in 16-17, and we're looking at our Pop Health Improvement activity. It's in a drop-down, so I can choose year by drop-down and activity by drop-down, very easy. And then it populates all the information into this screen, lets me know the budget, what facilities. So down below I have 3 facilities and 3 people at those facilities, so I know who my hospitals are and who my contacts are. And again, I can email them all in one swoop, or I can download their information into Excel. And then the budget information on the right lets us know what's left to invoice and what's been paid. So it's very easy if a hospital calls us and said, hey, I haven't gotten my invoice paid, can you check on that? And we very easily can bring this up and say, oh yeah, that's been paid, so that means it's coming, or we can check with our finance department to see where it's been held up. And as I mentioned before, keeping track of outcomes. So here's a nice example of a project we had with the Hospital Association called the EDTC Collaborative. So it's improving EDTC scores. And our outcome was to see if the project had any impact on any of these EDTC measures. So we start with a baseline, and then at the end of the project, we would enter the final result so we could see if there's been improvement. And you see I also have a tab for PIMS and for deliverables, which is also known as outputs. An example of milestones, so just bringing up a certain project and seeing what my start and end dates are, what I have to do, when I have to schedule some site visits, when the hospitals have to submit their work plans and budgets to me. And lastly, this is a sample report. So we're able to put in a date range. So we'll want to put in maybe from a few weeks back to, say, a few months from now. And we know who is in charge of a certain project. So I know I'm going to tell Kevin that he has to close the follow-up evaluation by February 3rd. And then I know things that I have to do and when my dates are. And that these can easily change. We can when we meet, first thing on Mondays when we meet. If a deadline has come up and we know it's just not going to happen, we can move the deadline and then be reminded again next week. I believe that's all I have. And I zipped through that kind of fast, not knowing if we'd have to be done by 3, but I'd love to answer questions.
Thank you, Catherine. Yeah, if there's any questions, press *2 or put those in the chat box.
Kyle had a question.
And
how much time does it take to set up your initial grant year, Catherine?
So usually what we do is our project assistant and myself will sit down, put this on our big TV screen so we can both look at it at the same time and enter milestones together. So we get a good start on it for sitting together for a good couple of hours, and then we'll kind of pick at it after that and add to it after that. And it really is evolving. So the initial setup might take a few hours, definitely not a few days or anything like that, because we are able to do a lot of basically cut and paste. But new projects are happening all the time. Reminders need to go in, so I can be entering a new project, you know, each month, for an example.
Thanks, Catherine.
Yeah, I'm just seeing if there's any other questions.
I answered most of them.
Oh, you answered, okay.
And the slides are available on the left side for download, and also in the confirmation email Maddie sent yesterday. We had both Rebecca's slides and the Wisconsin Office of Rural Health slide decks attached to as well.
I should mention that we've been asked by a few folks if we'd be willing to share this, and we're considering it. So if that's interesting to you all, please let Catherine or I know. We'd probably want to charge something for it, but we just do like a blank access database version of this. So we just have to look into it to see if it's feasible.
While we're waiting to see if there's more questions that come up for Catherine or John, Maddie is pulling up some polling questions, and we would love it if you take a real brief minute to fill these out for us. If we can get some feedback. I'm going to just give a couple updates, too, for things going on in the future here with SHIP while I see some people are making some comments in the chat box. The next SHIP TA webinar call is going to be in September, and it's going to, the topic will be the grant guidance for the fiscal year 19 competitive grant cycle. So the specific date and time for that call is going to be sent out to all of you in August. We did receive a lot of feedback on the SHIP TA assessment, that many of you would like to have more best practice resources from your peers, as well as innovative projects from the states, such as the database that was shared by Wisconsin Today. And therefore, moving forward over this summer, the SHIP program is developing 2 learning collaboratives that are going to be led actually by SHIP state teams. So just to be aware of that, more information is going to be sent to all of you within the next few weeks that will outline in detail those 2 learning collaborative topics, as well as the dates. And I see some other questions popping up in here, so I'll let John and Catherine answer those.